So obstructive sleep apnea is a very common problem in the United States. An estimated over 20 million Americans have moderate to severe sleep apnea, many of them undiagnosed. Obstructive sleep apnea is where the soft tissues, especially at the back of the tongue and in the throat, collapse at night, blocking the airway, leading to cessation of airflow, and then gasping for air after that as you try to breathe air in. Snoring is a sign of obstructive sleep apnea, especially if there are breaks or pauses in sleep. And the snoring is caused by turbulent airflow, by the blockage of airway at the back of the throat, vibrating the soft palate. Obstructive sleep apnea, if untreated, can significantly increase your risk of heart attacks, strokes, and especially high blood pressure. And in many people, not only do they have risks of this, it makes them very tired and unable to work well during the day. They're fatigued and aren't very productive at work. You get into higher risk of car accidents and car crashes because you can fall asleep at the wheel. And it really does affect, as we talked about, your heart and brain health. So how do you know if you have sleep apnea? Obviously, if your bed partner finds that you're snoring loudly at night, it's worth talking about to your primary care doctor, and they can refer you to an ENT doctor or other sleep doctor to be evaluated for this. How do we evaluate for sleep apnea? Well, there are two main ways. The first is a home sleep test. Nowadays, you can actually go home with a device or have it shipped to your home so that you can, from the comfort of your own bed, do a test to see if you have sleep apnea. It's not always as accurate in detecting sleep apnea as an in-lab sleep study, but it's very efficient, and for most people that will suffice. An in-lab sleep study is done with a technician who is there to monitor many different channels as far as your breathing, your oxygen level, your heart rate, and your brainwave activity. And this is a little more accurate than a home sleep study. So what are the levels of sleep apnea? There's mild, there's moderate, and severe. And things we look for are pauses in breathing for up to 10 seconds, which is called an apnea, or a decrease in breathing for 2 breath cycles, and dropping your oxygen level over 3 or 4% called a hypopnea. The treatment for this frontline is what's called continuous positive airway pressure, or CPAP. They actually have them now that are called APAP, that are automated and can detect what pressure you need blown through your nose and mouth to treat sleep apnea. So it doesn't always require a second night in a hospital or a sleep lab to figure out the pressure you need. CPAP is very effective for people who can tolerate it. Over 65% of people use CPAP effectively, they sleep well with it, and it gets rid of their sleep apnea. So always, frontline is CPAP. For people who can't tolerate CPAP, an oral appliance, which is a mouth guard that a dentist makes that goes on the top and bottom and is used over a course of 3 or 4 weeks, pulling the jaw forward till it gets to the most maximum position forward that you can tolerate, creating space at the back of the tongue so that air can get through. This is how the oral appliance works, and it's very effective for mild to sometimes moderate sleep apnea. Over 5 to 10 years, it can pull the jaw forward and stretch it out, so it may not be effective long term, but for many people, it's enough to really help improve their sleep and make them feel better during the day. A lot of times you will get a sleep study with the mouth guard in after you've been wearing it for a while to make sure it's effective. So what happens for the 35% of people who can't tolerate CPAP? Well, that's when you often get referred to a otolaryngologist, that would be myself, head and neck surgeon, in order to discuss other options. The surgical options would be to bring the tongue forward and to open up the airway. The newest one is something called Inspire. So that is a device that's implanted in the chest, which is a battery that lasts 11 years, and there's an incision in the neck as well to find the nerve that moves the tongue. There's a cuff that's put around this nerve so that about 6 weeks after surgery, when everything heals up and it's activated, you activate the device, and so at night what happens is that when you breathe in, a signal is sent to your tongue to push it forward, and it's very effective. Over 90% of people have significant satisfaction with this. There are other surgeries as well where you remove the tonsils and soft palate and then put a stitch around what's called the hyoid bone attached to the jaw to pull it forward. It's not always as effective, but it is a good option for people who are not candidates for Inspire.